Welcome. My name is Robert Tasker, and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. Another great month, September 2021, for PCCM content. Thank you for your continued support as readers and subscribers. Everything in this month's issue is worth reading, but for those who are pressed for time, here are my 3 choices that you should be reading. First, when to avoid blood cultures and prevent overuse. Woods Hill and colleagues of the Bright Star Collaborative provide us with 19 consensus statements on blood culture use. There's a great colour figure in the article, as well as an algorithm for what we should be doing. Our editorialist then picks up this theme and takes on how we take these statements and implement them. Implementation science, if you will. The second article is when in the time course of pediatric acute respiratory distress syndrome does fluid overload occur? Black and colleagues have carried out a retrospective study in 723 children with PARDS and looked at the cumulative and daily fluid overload balance and its relationship to outcome. Our editorialist picks up this theme and talks about the relevance of these data for our current practice, as well as for those planning randomized controlled trials. My third article asks the question, what do we really know about conversations on prognosis between practitioners and parents? Reisman and colleagues surveyed 100 paired respondents and provides us with useful information, and our editorialist gives us a 4-step plan to improved communications. This final article is picked up in my theme called Pediatric Critical Care Medicine Connections. In this month's issue, we have 2 papers by Moynihan and colleagues on the topic of discussions with family during a child's course of ECMO. First, there's a narrative review covering the evidence on communications during ECMO. And then secondly, there's a PCCM perspective presenting these authors' structured conversational approach in the iteration as they discuss with families with a child who is possibly dying or death is anticipated. These 2 papers, along with the Reisman paper, should be taken together with a paper that appeared in April 2021 from Settle and colleagues on the Therapeutic Alliance, and July 2021 from Bogetz and colleagues on supporting families with children with complex conditions. So lots to read. I hope you enjoy the read, and I look forward to seeing you again next month, as well as on Twitter. Many thanks.